Hey everyone, and welcome to another deep dive. This time we're going to get into some pretty cool science. We're talking about those three articles about biodegradable polymers, but like way beyond just reading them.
Yeah,
Like we're diving into how scientists are actually designing these polymers, like at the molecular level, to deliver medicine.
it's amazing how much control they have, right? Like they can tweak these polymers to release drugs slowly over time or target specific cells in the body.
Yeah, exactly. And what's super interesting to me is that they're all about finding alternatives to PEG, you
hmm
know, polyethylene glycol.
Right, PEG. It's been used in drug delivery for ages, but it's starting to show some downsides.
Yeah, from what I was reading in these papers, it sounds like it doesn't break down as easily as they uh, initially hoped.
Mm.
And there's even some worry about it building up in tissues or maybe causing immune reactions.
Yeah, there are definitely some concerns. It seems like a good time to be looking at some new options for sure.
Totally. Okay, so before we get too deep into the specifics of like what these papers are saying, maybe we should take a step back and talk about polymers in general, like for anyone who's, maybe not a polymer scientist.
Yeah, good point. So think of a polymer like a long chain made up of repeating units. You can kind of imagine it like a necklace with a bunch of beads on it.
Okay, so like a molecular chain, basically.
Exactly. And in drug delivery, these polymer chains, they act as like tiny containers, you know? They encapsulate the medicine and they carry it through the bloodstream.
Like microscopic little packages. That's cool.
Yeah, it's like targeted delivery right to where it needs to go.
Okay, so they're like tiny delivery trucks for medicine. Got it. Now, I know some common polymers that are used for this are like polyglycolic acid, polylactic acid, which is, yeah, usually just called PLA, and then there's polycaprolactone, or PCL for short. What are the researchers saying about these?
Right, those are all good examples. They've been used for a while now, but they do come with their own set of limitations. One of the main issues is that they can be hydrophobic.
Hydrophobic. So they don't like water.
Yeah, exactly. They don't really mix well with water, and that's a problem because, well, our bodies are mostly water.
Yeah, right. So for drug delivery, you kind of need something that's a bit more water
Yeah.
friendly.
Exactly. And on top of that, those common polymers, they don't always have convenient spots for scientists to attach things to. You can think of it like they're lacking molecular handles, so it's hard to modify them or to fine-tune their properties.
So it's like a delivery truck without any doors or tie-down straps. Not very useful.
Pretty much, yeah.
Okay, that makes sense. Now, these articles that you're helping me unpack, they introduce a couple of different polymers. There's polyglycerol adipate, or PGA, and then it's kind of cousin molecule, polydiglycerol adipate,
Yeah.
PDGA. What makes these stand out as like promising candidates for drug delivery?
Well, one of the key things about PGA and PDGA is that they're amphiphilic.
Amphiphilic, no, there's a word I haven't heard in a while.
It basically means that they have parts that love water and parts that repel water all within the same molecule.
Oh, so it's like those double-sided sponges, one for scrubbing, one for wiping.
A very apt analogy. And this amphiphilic nature, it's important because it allows them to self-assemble into nanoparticles.
Nanoparticles, those are those tiny drug-carrying containers, right?
Yes, exactly. Plus, both PGA and PDGA can be made using enzymes and sustainable solvents, which is a huge plus from an environmental perspective.
And that's what I call hitting the sweet spot, biocompatible, eco-friendly, and effective. But the scientists, they didn't stop there, did they? These articles are all about like taking these polymers and fine-tuning things even further.
Oh, absolutely. They're really trying to push the boundaries here. The research dives into how scientists are modifying both PGA and PDGA to try and make them even better at what they do. And they're doing this by adding a hydrophobic molecule called 1-vinyl-6-hexanediol into the polymer backbone. It's often shortened to just hex.
Okay, now this is where I get intrigued. Adding something hydrophobic, something that repels water, to a polymer that's going to be traveling in our like very watery bodies seems kind of counterintuitive. What's the thinking there?
Well, it's all about finding that perfect balance, right? And that's actually what's so fascinating about these studies. By carefully controlling how much hex they add to PGA or PDGA, the scientists, they can actually tweak the properties of those polymers in a very precise way.
So it's like they're adjusting a recipe, a little more of this, a little less of that, trying to get the perfect texture for their molecular cake.
I like that analogy. And they were looking at several things. Like, for instance, they looked at how adding hex affected the polymer's molar mass, basically how big the polymer molecules are.
Okay, so size matters in the nano world too, huh?
It definitely does. They also wanted to see how it changed things like melting points, which can give us clues about the polymer structure and how it might behave in different environments.
Makes sense. Did they look at, like, how these modified polymers interacted with water, too?
Yeah.
Given, the whole hydrophobic thing we were talking about earlier.
They did. They measured something called the water contact angle. Imagine placing a drop of water on a surface.
Yeah.
The angle that that water droplet makes with the surface, that tells you how hydrophobic or hydrophilic the surface is.
Okay, so, like, a high contact angle means the water beads up, like on a wax car, hydrophobic surface. And a low contact angle, it means the water spreads out, like on a clean window, hydrophilic.
You got it. Exactly.
So what did they find with these hex-modified polymers?
As they added more hex, that contact angle increased, showing that those polymers were becoming more hydrophobic.
Okay, so by adding this hex, they were essentially like fine-tuning the water-loving versus water-hating balance of these polymers.
Precisely. That's a great way to put it.
But I'm guessing, like, creating these modified polymers, that was just the first step, right?
Right. Once they had these modified PGA and PDGA polymers, the next challenge was purifying them. And for that, they used a technique called fractionated precipitation. It essentially involves dissolving the polymer and then adding something that makes it solidify and separate out, kind of like if you were filtering coffee,
Yeah.
separating the grounds from the liquid.
So they're getting rid of any impurities that could, like, mess things up down the line.
Exactly.
What did they learn from this purification process?
Well, it's interesting. They found that the purification didn't really change the polymer structure very much, but it did have a subtle effect on the polymer's ability to self-assemble into those all-important nanoparticles.
Interesting. So purification is a necessary step, but it's also something that they had to, like, carefully optimize. Kind of like how washing fruits and vegetables is good, but you don't want to scrub them so hard that you lose all the nutrients.
A perfect analogy. It's all about finding the right balance at every stage.
So they've got their ingredients prepped, they've got them purified. Time to see if they can bake that molecular cake. How do they go about actually forming those nanoparticles?
They used a method called nanoprecipitation, which involves dissolving the polymer in one solvent and then rapidly mixing it with another solvent that the polymer doesn't like. And this forces the polymer to quickly form nanoparticles.
It's like a microscopic version of making ice cream. You mix the ingredients and then rapidly cool them down to get that, like, smooth, creamy texture.
Precisely.
What solvents did they use for this nanoprecipitation process?
They tested two different solvents, acetone and THF. And here's where things get really interesting. They found that the nanoparticles formed using acetone, they were much more stable over time compared to the ones formed using THF.
Oh, a plot twist.
Right.
I'm guessing they didn't just, like, stop at noticing that difference. They dug deeper into why acetone might be the superior solvent here.
Oh, absolutely. And it turns out that the choice of solvent actually plays a huge role in how those polymer chains interact and ultimately how those nanoparticles form and behave.
So we're already starting to see that every single step in this process, from modifying the polymers to purifying them to choosing the right solvent for nanoparticle formation, can have a big impact on the final outcome.
Absolutely. Every detail matters at the nanoscale. It really is. It's like every little tweak can make a big difference in how these things work.
And speaking of those tiny tweaks, I'm remembering how the researchers were adding that 176-hexanadiol to the PGA and PDGA. We were calling it hex, for short.
Right, hex.
They were really interested in how that affected the self-assembly process, how these polymers form those nanoparticles.
Exactly, self-assembly. It's kind of a crucial process here.
Yeah, it sounds super futuristic to me, but I guess I'm wondering, why is it so important for drug delivery? Like, what makes it so special?
Well, it's essential because it lets scientists create these nanoparticles without having to, like, build them molecule by molecule. It would be incredibly tedious and time-consuming.
Oh, so it's like these polymers have a built-in blueprint for forming nanoparticles.
Yeah.
They just need the right conditions to, like, snap into place.
That's a great way to think about it. And the beauty of self-assembly is that by changing the polymer's properties, scientists can fine-tune the size, the shape, even the surface of those nanoparticles.
So by adding hex, they were essentially, like, tinkering with the blueprint, trying to optimize the design of those tiny delivery trucks.
Exactly. They were looking for the ideal configuration.
And to make this happen, to induce this self-assembly process, they used that nanoprecipitation method we talked about before.
Right.
Mixing the polymer solution with the solvent that it doesn't like.
Right.
They tested acetone and THF, and if you remember, acetone was the winner for creating stable nanoparticles. But I'm sure there's more to the story. Right. It can't be that simple.
Oh, there's always more to the story. So it turns out that the ratio of hex in the polymer, that also played a huge role in how well those nanoparticles formed.
Okay, so again, it comes back to finding the right balance, like a Goldilocks situation.
Exactly. Too much or too little of something can throw the whole system off. They found that there was a sweet spot, a certain hex ratio, that yielded the most stable and well-defined nanoparticles for both PGA and PDGA. If they added too little hex, the polymers were too hydrophilic.
Meaning they loved water too much.
Yeah, exactly. They just wouldn't form those nice, stable
They
nanoparticles.
just dissolve away like cotton candy in a rainstorm.
A very vivid image. And on the flip side, if they added too much hex, the opposite problem happened. The polymers became too hydrophobic, and the nanoparticles might clump together instead of staying nicely dispersed. Kind of like when you try to mix oil and water.
Yeah, it all separates out. So they had to like carefully adjust that recipe to get those nanoparticles just right. Now, I'm remembering one of the articles mentioned something about polymer purification
Yeah.
affecting the nanoparticles as well. What was that about?
Ah, yes. Good catch. You're right. The researchers, they used fractionated precipitation to purify their polymers, basically getting rid of any unwanted bits and pieces that could interfere.
Like sifting flour to get rid of any lumps before you bake a cake.
Exactly. And what they found was really interesting. While this purification process, it didn't really change the polymer structure that much, it did have a subtle effect on the nanoparticles themselves.
Okay, I'm curious. What kind of effect are we talking about here?
Well, in some cases, purifying the polymers actually made them better at self-assembling. Like, it made the whole process more efficient.
Interesting. So sometimes a little bit of cleaning up can actually make things run more smoothly.
Right. But in other cases, it actually made the self-assembly a bit less efficient. It's a delicate balance, you see.
So purification is important, but it's also something that you have to, like, handle carefully. It's a bit of a Goldilocks situation again. Too much purification, and you might end up losing some of the good stuff along with the bad.
Exactly. It really highlights just how important it is to optimize each and every step in this whole process. Nothing can be overlooked.
I see what you mean. Okay, so we've been talking a lot about polymers and nanoparticles, but let's shift gears a bit and talk about another really fascinating aspect of this research. Enzymes.
Enzymes, yes, those tiny biological machines.
I remember learning about those in school, but how do they fit into all of this? How do they come into play with biodegradable polymers?
Well, enzymes are actually involved in both the making and the breaking of these polymers. For example, the researchers, they used an enzyme called lipase to actually synthesize the PGA and PDGA polymers in the first place.
Really? So instead of using like harsh chemicals or high heat, they just let the enzyme do the construction work.
Exactly. It's like having a master builder at the molecular level, carefully assembling those polymer chains. This approach, it's called enzymatic polymerization. It's a much gentler and much more sustainable way to do things.
It sounds pretty elegant, actually.
It is. And plus, it gives scientists much more control over the final product. They can really fine-tune the properties of the polymers they're making.
So precision engineering at its finest. But wait a minute, enzymes. They're also involved in breaking down these polymers too, right?
You got it.
Yeah.
That's right. And that's really important for making sure that these polymers don't just accumulate in the body after they've delivered their medicine payload.
Right. Biodegradability, that's a must-have for any drug delivery system. We don't want those nanoparticles hanging around forever.
Absolutely not. And the researchers, they very cleverly designed their nanoparticles to be broken down by enzymes that are naturally found in the body.
So it's like those nanoparticles just gracefully exit the stage once their mission is complete. No trace left behind.
That's the idea. They've done their job, delivered the medicine, and then they're broken down and safely cleared from the body.
That's pretty reassuring, actually. Did the scientists actually look at how these nanoparticles interacted with specific enzymes?
They did. In one of the studies, they focused on how those nanoparticles interacted with lipase, the same enzyme that they used for the synthesis, which just goes to show how versatile lipase is.
Hold on. So they used the same enzyme for both building and breaking down the polymer. That's wild. What happened when they exposed those nanoparticles to lipase?
Well, you might remember that when we were talking about the nanoparticles breaking down, we talked about how they kind of swelled up a bit before eventually clumping together.
Yeah, like they were taking a deep breath before deflating.
Exactly. Well, they saw the same thing happen in this study. The nanoparticles, they swelled up initially when they were exposed to lipase.
Okay, so that swelling, that clumping, that's actually a good sign. It means the nanoparticles are actually degrading the way they were designed to.
Exactly. It's a sign that those polymers are being broken down into smaller, more water-loving fragments, which the body can then easily clear out. Now, we've been focusing a lot on the technical details here, but I'm curious, what does all of this mean for medicine as a whole? How could these biodegradable drug delivery systems actually change the way we treat diseases?
Yeah, that's the big question, isn't it? Like, what's the real-world impact of all this?
It's a big question, and it's one that makes this research so exciting. These systems, they have the potential to revolutionize how we treat a wide range of conditions,
Hmm.
from cancer and infections to autoimmune diseases, even genetic disorders.
So it's not just about delivering drugs more effectively. It's about opening up totally new possibilities for treatments altogether.
Absolutely. And one of the most promising aspects is something called targeted drug delivery.
Targeted drug delivery. Okay, I'm listening.
Imagine being able to deliver a medication directly to specific cells or tissues in the body, almost like having a GPS system for your medicine.
That would be amazing. Like, you could make sure the drug gets exactly where it needs to go and nowhere else.
Exactly. You could increase the effectiveness of the treatment while also reducing side effects. For example, with cancer, targeted drug delivery could allow doctors to deliver much higher doses of chemotherapy directly to the tumor while sparing the healthy tissue around it.
So less of those awful side effects that people often experience with chemo, like hair loss, nausea, fatigue. That would be huge.
It would be a game changer. And it's not just cancer, these systems could be used to deliver antibiotics directly to the site of an infection, which could help to reduce the risk of antibiotic resistance, a problem that's becoming more and more serious these days.
That's a really big deal. What about autoimmune diseases? Where the body's immune system mistakenly attacks its own tissues.
Well, targeted drug delivery could be transformative for those conditions too. It could allow doctors to deliver immunosuppressant drugs very precisely to just the areas that are affected, minimizing the side effects that you would get from suppressing the whole immune system.
So less collateral damage, basically. More precision medicine. Now, what about genetic disorders? Could these kinds of systems play a role there too?
Absolutely. There's actually a lot of research going on right now into using biodegradable nanoparticles to deliver gene editing tools or even therapeutic genes directly into cells.
Wow. So they could potentially correct the underlying genetic defect?
That's the hope. It's still early days, but the possibilities are incredible.
It really does feel like we're on the cusp of a whole new era in medicine.
We are. And it's all thanks to the creativity, the ingenuity, the sheer hard work of scientists who are pushing the boundaries of what's possible with these biodegradable polymers.
So we've covered a lot of ground in this deep dive. From the basic building blocks of polymers to the intricate dance of enzymatic synthesis and degradation to this idea of targeted drug delivery. It's amazing to think that we can now engineer these tiny microscopic particles to carry medicine exactly where it needs to go in the body.
It is remarkable, isn't it? And what's even more remarkable is that we've only just scratched the surface. There's so much more to discover, so much more to learn.
It really is mind-blowing. And, we've been talking about these concepts for a while now. I think it's time to, like, zoom in on some of the specific findings from the articles you sent over.
Yeah, let's get into the nitty-gritty, see what these researchers actually discovered.
Okay, let's start with that first article, the one that was all about PGA and PDGA. What were some of the key takeaways you got from that paper?
Well, one of the things that really stood out to me was how modifying those polymers, with the 1,6-hexanyl, the hex, how that really affected their ability to form stable nanoparticles.
Right, right. They were trying to find that sweet spot between being hydrophilic and hydrophobic.
Yeah.
Like tweaking the polymers to find that perfect balance for drug delivery. What did they figure out?
Well, they found that the ratio of hex to the glycerol or diglycerol in the polymer backbone, that was like super crucial for nanoparticle stability.
So like how much hex they added really mattered.
Yeah, if they added too much hex, the nanoparticles, they became too hydrophobic,
Yeah.
and they would start like clumping together instead of staying all nice and dispersed in water.
So it's like, when you try to mix oil and water and it all just separates out?
Exactly. But then, if they didn't add enough hex, the opposite happened. The nanoparticles, they were too hydrophilic and they couldn't, like, hold their shape.
They just kind of fall apart.
Pretty much, yeah. It would be like trying to build a sandcastle with soggy sand.
It just wouldn't work. Okay, so they had to get that hex ratio just right for both the PGA and the PDGA. Sounds like they created a blueprint for other researchers to follow.
Yeah, I think so. I mean, it definitely gives a good starting point for designing these kinds of drug delivery systems.
Awesome. Now, I'm also remembering that they confirm these nanoparticles are biodegradable, which is good. We want them to break down safely in the body.
Right, we definitely don't want them hanging around after they've done their job.
So how did they test for that, the biodegradability?
Well, they use a technique called DLS analysis, and it basically lets you track the size of particles over time. They actually observed the nanoparticles like swelling up a bit at first when they were exposed to enzymes, and then they would eventually aggregate together as they broke down.
Yeah, you explained that swelling thing earlier. Like they're taking a deep breath before they disappear.
That's a great way to put it, and it's a good indication that those polymers are degrading as planned,
Yeah.
breaking down into smaller fragments that the body can clear out.
Okay, cool. Now I want to shift gears a bit and talk about that second article, the one that used Chitosan nanoparticles to encapsulate sodium usnate. I thought that one was really interesting because it was tackling the toxicity issue of a cancer drug.
Yeah, that was a really innovative approach. So sodium usnate, it's a promising anti-cancer drug, but it can also be pretty harmful to the liver.
Right, that's a problem. So what do they do about it?
Well, that's where the beauty of nanoparticle encapsulation comes in. By packaging that drug inside those chitosan nanoparticles, they were able to reduce the toxicity to liver cells significantly.
Oh, that's awesome. So it's like the chitosan acts as a shield, letting the drug get to the cancer cells, but minimizing the damage to the liver. But did they also show that the encapsulated drug could still, actually kill the cancer cells?
Yeah, they did. They tested the encapsulated drug on osteosarcoma cells, which is a type of bone cancer. And it turned out it was still really effective.
Wow, so they got the best of both worlds. Less toxicity and still effective against cancer. But I feel like there was more to that study too, right? Didn't they look at how those chitosan nanoparticles were working against the cancer?
Yeah, you've got a good memory. They focused on a protein called maspin. It's known for its tumor-suppressing properties, particularly in osteosarcoma.
So Maspin's like the good guy, keeping the cancer cells in check.
Yeah, exactly. It helps to prevent those cells from growing and spreading.
So what do they find out about Maspin and the chitosan nanoparticles?
Well, the results were really cool, actually. They found that the chitosan nanoparticles loaded with the sodium asrinesate, they were much more effective at stimulating maspin production than either the free drug or empty chitosan nanoparticles.
Whoa, really? So those nanoparticles are not only protecting the liver, but they're also giving a boost to the body's own cancer-fighting defenses.
Yeah, it's a pretty impressive combo. It's like a double whammy against cancer.
I love it. Okay, so we've been talking a lot about cancer, but I know that article you sent, it explored other potential applications of biodegradable polymers for drug delivery.
Oh, yeah, for sure. That one focused on the versatility of PGA-based copolymers.
Copolymers, okay. Refresh my memory, what are those again?
A polymer, it's basically a polymer that combines PGA with other types of molecules.
So it's like they're creating a hybrid polymer, taking the best of both worlds.
Exactly. And in the study, they created a whole library of these PGA-based copolymers by incorporating different molecules into the backbone of the polymer.
So they were experimenting with different ingredients to see how they could tweak the properties of that polymer, like a chef trying out different flavor combinations.
I like that. And they found that certain modifications, like adding a molecule called 2-hydroxyethyl disulfide, it led to nanoparticles that were even more stable and even better at encapsulating drugs.
So it's all about finding the right recipe, huh?
It really is. They also looked into how well those nanoparticles could penetrate biological barriers, like the dense network of molecules that surrounds tumors.
Oh, right, because if the nanoparticles can't actually get to their target, the drug won't be very effective.
Exactly. And what they found was that some modifications, like adding the 1'6-hexanediol, the hexyls we were talking about earlier,
Huh?
well, that actually helped the nanoparticles to cross those barriers more easily.
That's a big deal. It's like giving those nanoparticles the key to unlock the door to the tumor. Now, I'm assuming they also tested for toxicity with these new copolymers, right?
Oh, absolutely. Safety is always the top priority. They did both in vitro tests, which use human cells, and in vivo tests using C. elegans worms. Remember those?
Yeah, those tiny little worms. And how did it go? What were the results?
Well, the results were really encouraging. It looks like the PGA-based copolymers and their nanoparticles, they were well tolerated even at pretty high concentrations.
That's great news. It sounds like these PGA-based copolymers have a lot of potential for like a wide range of drug delivery applications. Wow. This has been an incredible journey. We went from the basics of polymers all the way to nanoparticles delivering medicine to exactly where it needs to go in the body.
It's amazing to think that we can now design these tiny microscopic particles to do all that, right? It's really a testament to the power of science and human ingenuity.
It really is. And all of you listening out there, thank you so much for joining us on this deep dive. We hope you learned something new today. And hey, who knows, maybe someday you'll be the one designing these next-generation, life-changing drug delivery systems. Until next time, keep those brains buzzing.